Most people find out their blood sugar is dangerously high in one of two ways. Either they go for a routine blood test and their doctor calls them with numbers that require an immediate conversation, or they wait long enough that the damage already done to their body sends them to the emergency room. Neither of these is the way it has to go, because the body, long before any blood test reveals the problem on paper, sends clear and recognizable signals that something is wrong with the way it is managing glucose. The challenge is that most people do not know what those signals are. They notice them individually and explain each one away as stress or aging or not sleeping well or any number of other reasonable-sounding explanations that allow them to avoid the more uncomfortable possibility. And while they are explaining these signs away, the high blood sugar continues doing its quiet, systematic damage to their blood vessels, their nerves, their kidneys, their eyes, and their heart. Understanding the signs your body sends when blood sugar is very high is not just useful information. For many people, it is the difference between catching a manageable problem early and discovering a serious one late. What you are about to learn is what your body is trying to tell you before any lab result confirms it. Before we begin, please subscribe and turn on notifications so you never miss health content like this. Now let us go through all 16 signs that your blood sugar may be very high so you know exactly what to watch for. Sign number 16. You are urinating far more frequently than usual, including waking up at night to urinate. Most adults urinate somewhere between 4 and 7 times in a 24-hour period. If you are significantly exceeding that number, or if you are waking up once, twice, or more during the night to urinate when this was not previously your pattern, high blood sugar is one of the most important things to consider. Here is what is happening. Your kidneys are remarkable filtration organs, processing approximately 180 liters of blood every day. Under normal circumstances, virtually all of the glucose that passes through the kidneys gets reabsorbed back into the bloodstream. But when blood sugar rises above a certain threshold, commonly around 180 milligrams per deciliter, the kidneys cannot reabsorb all of it. The excess glucose spills into the urine, and because glucose is osmotically active, meaning it draws water to it, it pulls large amounts of fluid out of the body along with it. The result is significantly increased urine production and significantly increased urinary frequency. Nighttime urination in particular is a pattern that many seniors chalk up to normal aging or prostate issues in men. While those factors can certainly contribute, a sudden increase in how often you wake to urinate warrants a blood sugar check, especially if other signs on this list are also present. Sign number 15. Your vision has become blurred or distorted. If you have noticed that your vision seems temporarily unclear, that things that used to be sharp now seem slightly fuzzy, and especially if this seems to vary, being worse at some times than others, high blood sugar can be the direct cause. The lens of your eye adjusts its shape to focus images on the retina. This adjustment depends on the lens maintaining a specific degree of hydration and flexibility. When blood sugar rises significantly, the osmotic pressure changes in the fluid surrounding the lens, causing it to absorb more water than usual, which changes its shape and its refractive properties. The result is a shift in the focal point of the eye that produces blurring. This type of vision change is often temporary and does not indicate permanent eye damage at this stage. However, chronically elevated blood sugar over months and years does cause permanent damage to the tiny blood vessels supplying the retina, a condition called diabetic retinopathy, which is the leading cause of preventable blindness in adults. Catching the blood sugar problem at the blurred vision stage before retinopathy develops is exactly the kind of early intervention that protects long-term vision. If you experience blurred vision accompanied by any other signs on this list, do not simply purchase reading glasses or assume the problem is refractive. Have your blood sugar checked. Sign number 14. You are having difficulty concentrating or experiencing unusual mental fogginess. Your brain is one of the most glucose-dependent organs in your body, using approximately 20% of your body's total energy supply despite representing only about 2% of your body weight. You might therefore assume that high blood sugar, meaning more glucose available, would sharpen mental function. The reality is the opposite, and understanding why is important. When blood sugar is very high, insulin resistance, which is the underlying mechanism in type 2 diabetes and prediabetes, means that glucose cannot enter the cells that need it, including brain cells, efficiently. The glucose is in the blood in high concentrations, but the door that allows it into the cells is not working properly. Brain cells deprived of the fuel they need despite a surplus floating just outside them begin to function less effectively. Attention becomes harder to sustain. Memory feels less reliable. Tasks that used to feel routine require more conscious effort. Thinking feels like moving through something thick. Many seniors experiencing this fog attribute it to age-related cognitive decline or simply getting older. And while cognitive changes do occur with aging, a sudden worsening of mental clarity, especially paired with other signs on this list, should prompt a blood sugar evaluation before any other explanation is accepted. Sign number 13. Your mouth is consistently dry regardless of how much you drink. Chronic dry mouth, the persistent feeling that your mouth lacks moisture, that your saliva is insufficient, that your tongue and cheeks feel papery even after drinking water, is a frequently overlooked sign of elevated blood sugar. The connection works through two mechanisms. First, the increased urination produced by high blood sugar draws fluid from the entire body, including the salivary glands, reducing saliva production. Second, high glucose levels in the blood result in elevated glucose in the saliva, which alters its consistency and reduces its effectiveness at coating and lubricating the oral tissues. Dry mouth from high blood sugar is not just uncomfortable. Saliva performs critical protective functions in the mouth, neutralizing acids, washing away food particles, and suppressing the bacteria responsible for tooth decay and gum disease. This is part of the reason why people with poorly controlled blood sugar tend to experience more dental problems. If you are drinking adequate fluids and still experiencing persistent dry mouth, this is a sign worth taking seriously. Sign number 12. You are experiencing recurring infections or finding that infections are taking longer to clear than they used to. High blood sugar creates an environment that is significantly more favorable to bacterial and fungal growth and significantly less favorable to the immune defenses that normally contain them. Glucose at elevated concentrations essentially provides additional fuel for pathogens and simultaneously impairs several components of the immune response, including the ability of white blood cells to identify, pursue, and destroy infectious organisms. The types of recurring infections most specifically associated with high blood sugar include urinary tract infections, particularly in women, yeast infections, skin infections, gum infections, and dental abscesses, and slow healing or repeatedly infected wounds. Fungal infections of the skin, nails, or mucous membranes are especially common because fungi thrive in high glucose environments. If you find yourself returning to the doctor repeatedly for the same type of infection, or if infections that should resolve in a week or two are persisting for much longer, this pattern is a meaningful clinical signal that your immune system may be operating in a high-sugar environment that is undermining its effectiveness. Sign number 11. You have wounds, cuts, or bruises that are healing significantly more slowly than expected. This is one of the most important signs on this list, and it is also one of the most commonly ignored because it is easy to rationalize. A cut that takes a week to heal instead of 3 days, a bruise that takes 2 weeks to fade instead of 1, a blister that becomes infected instead of resolving. These seem like minor inconveniences. They are actually warning signals from a body whose healing capacity is being compromised. Proper wound healing depends on adequate blood circulation to deliver oxygen, white blood cells, nutrients, and growth factors to the wound site. High blood sugar damages the small blood vessels responsible for this local circulation, reducing the supply of everything the wound needs to repair itself. It also impairs the function of the cells that lay down new collagen and skin tissue, and as noted above, it suppresses the immune response that prevents infection from taking hold in the wound. The combination of reduced circulation, impaired cellular repair, and compromised immunity in the setting of high blood sugar produces healing times that are noticeably, sometimes dramatically, prolonged. If you have noticed this pattern, it warrants immediate attention. Sign number 10. You are experiencing stomach problems including bloating, nausea, or a feeling that food sits in your stomach for an unusually long time. The digestive system is controlled in significant part by the autonomic nervous system, the network of nerves that regulates the body's automatic functions. High blood sugar over time damages these nerves, including the vagus nerve that controls the rate at which the stomach empties its contents into the small intestine. When the vagus nerve is compromised by chronic high glucose exposure, stomach emptying slows significantly, a condition called gastroparesis. Even before gastroparesis is fully established, elevated blood sugar produces functional slowing of gastric emptying that causes bloating, abdominal distension, a persistent feeling of fullness, nausea, especially after meals, and in some cases, vomiting of undigested food eaten hours earlier. If you find that meals that previously caused no digestive discomfort now leave you bloated, uncomfortable, or nauseous, and especially if you notice that this is worse after larger or higher carbohydrate meals, this is a pattern worth investigating from a blood sugar perspective. Sign number 9. You feel constantly fatigued or exhausted even after adequate sleep. This is one of the most universal signs of high blood sugar and also one of the most consistently misattributed. Constant fatigue in seniors is so readily explained by age, by activity level, by poor sleep, by any number of medications that the blood sugar explanation is frequently overlooked. The mechanism is the same as the cognitive fog mechanism. When glucose cannot enter cells efficiently due to insulin resistance, those cells are starved of energy even in the presence of abundant glucose. Muscle cells that cannot access glucose cannot contract with normal efficiency. Every physical activity requires more effort than it should. The body diverts enormous energy to the kidneys, which are working overtime to filter and excrete the excess blood sugar. The inflammatory state that accompanies chronic high blood sugar itself consumes significant energy resources. The fatigue of high blood sugar has a specific quality that many people describe as deep, bone-level tiredness, not the tiredness that a good night of sleep fixes, but a persistent heaviness that is present regardless of how much rest is obtained. If this is your experience, and especially if it has developed gradually over months rather than corresponding to a specific change in your lifestyle or sleep patterns, a blood sugar evaluation should be a priority. Sign number 8, you feel thirsty far more than usual, including during and immediately after drinking fluids. Excessive thirst, which doctors call polydipsia, is one of the classic triad of diabetes symptoms alongside excessive urination and excessive hunger, and it is directly connected to the kidney mechanism described under sign number 16. As the kidneys excrete large amounts of glucose-rich urine to manage high blood sugar, the body loses significant fluid volume. The brain detects this fluid loss through specialized receptors that monitor blood concentration and triggers an intensified thirst signal in an attempt to replace the lost fluid. The problem is that drinking more water temporarily replenishes the lost volume, but does nothing to reduce the blood sugar that is causing the ongoing fluid loss. So thirst returns quickly and the cycle continues. Many seniors are not good at detecting thirst in the first place because the thirst sensation becomes less sensitive with age, meaning the body has to reach a more significant level of dehydration before thirst is perceived. High blood sugar worsens this by creating a state of dehydration at the cellular level even when adequate fluids have been consumed. If you find yourself reaching for water more often than usual, or if you are waking thirsty during the night in addition to waking to urinate, take this combination of signs seriously. Sign number 7. Your skin is dry, itchy, or frequently irritated, particularly on your lower legs. Healthy skin depends on adequate circulation to deliver moisture and nutrients to skin cells and on a skin barrier that is intact and functioning properly. High blood sugar compromises both. The small blood vessels in the skin are among the first to be damaged by chronically elevated glucose, reducing the circulation that keeps skin supplied and hydrated. This produces the dry, tight, flaking skin that many seniors with undiagnosed high blood sugar notice, particularly on their lower legs where peripheral circulation is most easily compromised. The reduced circulation also makes skin less able to regulate temperature and more susceptible to damage from friction, pressure, and minor injury. The itching associated with high blood sugar, which can range from mild skin irritation to genuinely disruptive itching, particularly at night, results from a combination of dry skin, the effect of glucose on nerve endings in the skin, and the proliferation of skin fungi that thrive in a high glucose environment. If you experience persistent itching that does not respond to moisturizing creams or that keeps returning, particularly if it is concentrated on the lower legs, ankles, or feet, this is a sign worth evaluating from a metabolic perspective. Sign number 6. You are frequently hungry, even shortly after eating a full meal. This seems counterintuitive. If there is too much glucose in the blood, why would the body signal that it needs more food? The answer lies in what is happening at the cellular level. Hunger is triggered not by blood glucose levels per se, but by the availability of glucose inside cells. When insulin resistance prevents glucose from entering cells efficiently, the cells experience energy deficiency even though the blood is flooded with glucose. This cellular energy deficiency sends the same hunger signal it would send if you genuinely had not eaten enough. You feel hungry because your cells are hungry, regardless of what your blood glucose meter would show. Additionally, high blood sugar impairs the production and function of appetite-regulating hormones, including leptin, which signals satiety to the brain. When these hormonal signals are disrupted, the feeling of fullness after a meal is reduced or delayed, and hunger returns sooner than it should. If you notice that you are eating meals that would previously have satisfied you for several hours and feeling hungry again within an hour or two, or if you find yourself eating significantly more than usual without a change in your activity level, this persistent hunger is a sign that warrants blood sugar evaluation. Sign number 5. You have noticed unexplained weight changes, either gaining abdominal fat or, in some cases, losing weight without trying. Weight changes associated with high blood sugar can go in either direction, depending on which metabolic mechanism is dominant, and both directions are clinically meaningful. The more common presentation in prediabetes and early type 2 diabetes is accumulation of abdominal fat, particularly the visceral fat that sits around the internal organs rather than just under the skin. This happens because insulin resistance causes the pancreas to produce more and more insulin in an attempt to drive glucose into cells, and high insulin levels specifically promote fat storage, particularly in the abdominal region. The cells are not using glucose efficiently for energy, so more of it gets converted to stored fat. The accumulation of abdominal fat is not just a sign of high blood sugar. It also worsens insulin resistance, creating a feedback loop that progressively elevates blood sugar further. A waist circumference above 35 inches in women and 40 inches in men is associated with significantly increased metabolic risk. And if you have noticed your waistline expanding without obvious corresponding changes in your eating or activity habits, this is a metabolically meaningful sign. In contrast, some people with very high blood sugar, particularly those moving toward or into diabetic ketoacidosis, experience unintended weight loss despite normal or increased food intake. This happens because the body, unable to use glucose for fuel, begins breaking down fat and muscle tissue for energy. Unintended weight loss of this type, particularly combined with other signs on this list, requires immediate medical evaluation. Sign number 4, you are experiencing nerve sensations, including tingling, burning, or numbness, particularly in your hands and feet. This sign represents a more advanced stage of blood sugar damage, and its presence warrants urgent attention. When blood glucose remains elevated over months and years, the small blood vessels that supply the peripheral nerves, the nerves that extend into the hands, feet, arms, and legs, are damaged in ways that deprive those nerves of the oxygen and nutrients they need to function normally. The result is diabetic peripheral neuropathy, which is the most common complication of prolonged high blood sugar and affects approximately 50% of people with diabetes at some point. It typically begins in the feet with tingling that resembles pins and needles, a burning or hot sensation in the soles of the feet, or numbness that makes the feet feel as though they are encased in a stocking. Over time, it can progress up the legs and into the hands. The loss of sensation that neuropathy produces in the feet is particularly dangerous for seniors because it removes the pain warning system that would normally alert them to wounds, pressure sores, or infections on the feet. Foot wounds that go undetected because the person cannot feel them can progress to serious infection and, in severe cases, to tissue death, which is the mechanism behind the amputations associated with poorly controlled diabetes. If you are experiencing any persistent tingling, burning, or numbness in your extremities, particularly your feet, this is not a sign to observe and wait. It is a sign to investigate immediately. Sign number 3. You have noticed skin changes, including darkening in skin folds or unusual skin tags. Certain visible changes to the skin are specifically associated with elevated blood sugar and insulin resistance, and they can appear years before a formal diabetes diagnosis, making them valuable early warning signs. The most diagnostically specific is a condition called acanthosis nigricans, which produces darkened, velvety, thickened patches of skin, most commonly in the folds and creases of the body, particularly the back of the neck, the armpits, the groin, and sometimes the knuckles and elbows. This darkening is caused by elevated insulin levels, stimulating the growth of skin cells, and it is so strongly associated with insulin resistance that its presence in a person who has not been tested for blood sugar problems is a near universal recommendation from dermatologists for immediate metabolic evaluation. Skin tags, which are small, soft, flesh-colored growths that hang from the skin on a thin stalk, are also associated with insulin resistance and high blood sugar, particularly when they are numerous or appear in clusters in skin folds. While a single skin tag means very little, multiple skin tags developing in middle or older age, particularly in someone who has not had them before, can be an indicator of the elevated insulin environment associated with insulin resistance and high blood sugar. If you have noticed any of these skin changes, particularly the characteristic darkening of skin folds, discuss them with your doctor alongside a request for a blood sugar evaluation. Sign number 2. You are experiencing frequent headaches that seem to have no clear cause. Headaches have many causes, and high blood sugar is not the first thing most people think of. But chronically elevated glucose produces headaches through several mechanisms that make recurring unexplained headaches a sign worth noting in this context. The dehydration produced by high blood sugar is itself a common headache trigger. As the kidneys excrete glucose-rich urine and the body becomes gradually depleted of fluid, the tissues surrounding the brain, which rely on adequate hydration to maintain their pressure and cushioning function, are affected, and the resulting tension and pressure changes can produce headaches, particularly upon waking in the morning. High blood sugar also causes fluctuations in the osmolality, meaning the concentration of the fluid surrounding brain cells, and the brain is exquisitely sensitive to these osmotic changes. Rapid shifts in blood sugar, whether rising quickly after a high carbohydrate meal or falling after a period without eating, produce osmotic shifts that brain tissue experiences as stress, often manifesting as headache. If you have noticed that you are experiencing headaches more frequently than in the past, particularly morning headaches, headaches after meals, or headaches that occur with the other signs described in this video, include this in the picture you present to your doctor when requesting blood sugar evaluation. Sign number 1. You feel generally unwell in a diffuse, hard-to-describe way that has been building gradually. This final sign is the hardest to characterize and probably the most important to acknowledge. When blood sugar is chronically elevated, the systemic effects on circulation, nerve function, cellular energy, immune defense, and inflammatory signaling produce a constellation of general unwellness that many people experience as simply not feeling like themselves or not feeling as well as they used to without being able to point to any single symptom. This diffuse, unwell feeling often develops so gradually that the person cannot identify exactly when it started. It includes a persistent low-grade fatigue that does not improve with rest, a reduced tolerance for physical exertion, a general heaviness or lack of vitality, sleeping without feeling restored, and a sense that the body is working harder than it should to do ordinary things. Because none of these feelings are specific or dramatic, they are among the most commonly dismissed signs of high blood sugar, both by the people experiencing them and by medical providers who cannot point to a single explaining pathology. If this is your experience, and especially if you also recognize any of the more specific signs described above, trust your body's signal and pursue blood sugar testing before waiting for something more definitive to develop. Now that you know all 16 signs that your blood sugar may be very high before any blood test confirms it, here is what to do with this information. If you recognize one or two of these signs in isolation, it does not necessarily mean your blood sugar is the cause. Many of these signs have multiple possible explanations. But if you recognize 3 or more of these signs, particularly if several of them have developed gradually over recent months, a fasting blood glucose test and an HbA1c test are the appropriate next steps. Both are simple, inexpensive blood tests that your doctor can order, and both provide clear information about whether your blood sugar levels have been elevated. The HbA1c in particular, which measures your average blood sugar over the previous 2 to 3 months, is especially valuable because it cannot be influenced by what you ate the day before the test and provides a more accurate picture of your typical blood glucose environment than a single fasting measurement. The earlier elevated blood sugar is identified, the more options are available for addressing it before significant damage has accumulated. Many people who catch prediabetes or early type 2 diabetes through recognition of early signs like these are able to make dietary and lifestyle changes that restore normal blood sugar levels without medication. The window for that kind of intervention is early. The signs described in this video are exactly that early window. Do you recognize any of these signs in yourself or someone you care about? Let us know in the comments section below what prompted you to watch this video and what you are planning to do next. Your experience helps other viewers recognize their own signs and take action sooner. If this information has been useful to you, please hit the like button and subscribe so you never miss health content designed to help you recognize and respond to what your body is telling you before a crisis makes the decision for you. Thank you for watching, and please, if you see yourself in this list, make the appointment. Your body has already been asking. Now you know how to listen.